All right, day number 19 of the 27-day mobility challenge here at the Reprogram, and we are moving on to thoracic, the thoracic spine, testing extension and rotation. We've come away from the shoulder, we've come away from the wrist, we've done all that. Now we're moving on to the inside line and down to the lower body. All right, and again, all these essential range of motion tests are to test that you have the minimum amount of joint range of motion, or what I would call the ideal amount of joint range of motion necessary for you to perform and function in doing whatever you want to do, whether it be a physical training program, a day-to-day chores, physical activity, any kind of function via your body. It needs this range of motion. These tissues and joints are designed to have this amount of range of motion, at least, in order for you to function with a reasonable degree of safety, minimal injury risk, and minimizing the degree of damage should you get injured, okay, on the off chance that you do. Okay, so this test is a modified version of the half kneeling rotation test. It is called the thoracic archer, and I'll show that to you in a minute. But and the thoracic compartment particularly is really important to focus on, and I believe it doesn't actually have enough focus on, because the thoracic part of the spine is the key base of support for the shoulder girdle. It is right next to the lumbar spine, and it's right next to the cervical spine. So if it is right in this region here, and then we've got, if this region is off, where we rotate and extend, either the neck is going to suffer or the lower back, the lumbar is going to suffer. And a lot of the times these places do suffer. Not only that, but also with a crappy position or kyphotic thoracic spine or weak upper back muscles, we also get an offset of scapular mechanics and shoulder mechanics, shoulder pain, scapular winging, impingement, right? And it's just a plethora of upsets that can happen if you are not focused on this area as well. And because it is our main supportive structure, the actual skeleton, the spine, right, this is our main prop for our standing posture, it is the first thing to notice as well when we start working at a desk, start getting sedentary, reducing our physical activity, sitting at a desk all day, going home, watching TV. It is just repetitive compress, compress, compress. So it has a huge impact on our respiratory function. And not a lot of people know this or think about this. If we're completely compressed all day and we're lacking this ability to extend and open our chest to the world, right? Men, right, in particular, you want to open your chest to the world. Look at me, I'm ready, I'm confident, I've got high self-esteem. That's what your body likes, right? So that's what our respiratory system likes. When the ribs can expand, we get a huge uptake of oxygen, or we maximize our uptake of oxygen, and it changes the processes and makes the processes in our body, our physiology, much more efficient. More oxygen in the brain, we're in a better mood. More oxygen in the blood, and so on, right? So it also helps recovery when we do start physical training or physical activity. So don't be surprised, particularly if you when you haven't been training for a while, or you want to get in shape, you want to start a healthy routine, you want to change your lifestyle. This part is suffering, right? And you can't personally tell, maybe because you're so used to this compressed position or this hunched position that you don't notice it anymore. But when you actually start pushing yourself, when your body's requiring that oxygen, you'll realize that you can't actually get that full lungful because the ribs cannot expand. The tissues have locked down, they've got used to this compressive posture, and so on and so forth. So this exercise, or this screening tool, is really good for assessing that and starting to correct that. Okay, and I will show you this now. All right, so this is the thoracic archer, a modified version of the half kneeling rotation test. And we're using, the good thing about using a wall is that you get a really good sense of biofeedback. It allows you to understand the coaching cues, which I'll go through in a minute, and you'll see why using things like the wall and the floor, and how I've modified these tests so that you can do these at home, really helps, because basically if some part doesn't touch the wall, it's a fail. If some part doesn't touch the floor, it's a fail. Okay, and it stops you from overshooting the mark as well. And that's a big problem in today's, I would say today's industry, but really with people trying to stretch or mobilize, they don't actually know where the line is, where the limit is. Okay, they do it as a force of habit. A lot of them, they go, I'm going to work out, I'm going to stretch. Finish my workout, I'm going to stretch. But if you have that level of movement already, there is no point in stretching. It does nothing. It doesn't aid recovery. It doesn't reduce muscle soreness. Okay, so the only reason to mobilize at all is if you are missing length in certain tissues, or you're missing a range of motion that we need. Okay, so consider that. All right. So this is the thoracic archer, and here it is. So we go into this half kneeling position, much like the thoracic wall wipers. We're basically having the outside leg up, the inside leg down. Okay, and what you're going to do is you're going to position your hands like you're about to fire a bow and arrow. So hands in front, and this hand, the inside hand, goes on the wall, and the other side, you can touch the hand, but level is fine. And you're basically going to pull back to touch the wall here. Okay, and now notice this knee does not turn out. So we're coming back, we're extending through the spine, elbow touches the wall, coming back again. Elbow touches the wall, coming back again, okay? And that is a pass. That shows that I have adequate rotation through the thoracic, and then it doesn't influence the rest of my body. And that would be indication of a fail, okay? So when you guys try it at home, and you want to try and get to the bottom of your lower back pain, neck pain, bad shoulder mechanics, this is a good place to start. Check your thoracic, okay? So if you do this, classic signs of a fail would be this. So as I pull back, I can't keep this elbow up. This drops, I end up basically pulling the elbow back, and the shoulder doesn't touch the wall, okay? It is purely just the elbow in a lower range. So you want to make sure we keep this line, just like if I was firing a bow and arrow, okay? Bam, right? So that is one failure, would be a drop of the elbow. The other failure would be, as I come round, I don't have that rotation, and this knee turns out. This drops out like this, in order to get this elbow to touch, all right? Those are your two main failing points. That was the most common ones I see. Now, depending on your posture, you might actually struggle with the extension part as well. So if you are kind of kyphotic like this and you try it, you'll just end up you won't be able to do it, and you'll end up kind of doing the whole bit where this turns out, this elbow drops, you just won't make that rotation. So it's a really good screening tool for minimal levels, well, not minimal, for the ideal level of thoracic extension and rotation capacity. Okay, no, it's not really passive, because we're actively moving through it, but that's kind of the best guide that you can use. The half kneeling rotation test clinically would be the one I use anyway, possibly an open book test, but that doesn't matter. It doesn't matter what they're called. What we're testing for is adequate thoracic extension, adequate thoracic rotation, and trying to diagnose or prevent any injuries. Okay? So thanks for listening. If you like what you're hearing and you like what I'm talking about, check us out at www.thereprogramonline.com. We'll see you tomorrow. Check this out.
Hi there, I'm Andrew Graham, founder of the Reprogram Online, and if you're here, it's likely because you are feeling the frustration of a body that just isn't performing the way it used to. Maybe it's a nagging joint pain, the frequent injuries, or the simple truth that despite all your efforts, you're not seeing the results you desire. As a busy professional, I understand how valuable your time is. You want a body that not only performs well, but one that you can enjoy and that you know is capable of handling whatever life throws your way. Yet, finding the right path in today's fitness industry is like navigating an untamed jungle of misinformation, quick fixes, and empty promises, often leaving you frustrated or worse. That's why I created the Reprogram, a comprehensive training system designed to not only build a strong athletic physique, but to do it in a way that prioritizes injury prevention, joint health, and longevity. By merging concepts from physical therapy and strength and conditioning, the Reprogram targets and alleviates the very issues that are keeping you from moving forward. Starting with our free mobility assessment, we will identify these issues, as well as your potential risk of injury, and design your training program based on your results. You see, many people think they need more, but often what they really need is better. It's not about lifting the heaviest weight or doing endless reps. It's about focusing on what truly matters so that you can build a body that's not only aesthetic, but resilient. A body that works with you, not against you. The Reprogram is built for men who understand that their body is their most valuable asset and who refuse to let joint pain and past injury dictate their future. Using the 3-stage training system, you'll regain your mobility, correct muscle imbalances, and improve your posture, all with minimal equipment. I mean, imagine a life where you're not just managing pain, but actually eliminating it and getting stronger every day. Believe me, I understand the frustration of trying to stay active when your body seems to resist every step. But with the right approach, that frustration can quickly turn into fuel for change. The Reprogram is designed to respect your time and deliver results in a way that actually teaches you about your body. So, are you ready to break the cycle and unlock your potential? Then I invite you to start your journey today. Remember, this is about you, investing in your future, your health, your quality of life. Click the Get Started button to begin your free mobility assessment. I'm Andrew Graham, and I'm here to help you banish pain, optimize mobility, and unleash strength one step at a time. Let's get started.